update on the numbers. We are at 137,232 cases of COVID-19 reported to Sacramento County. We're averaging about 500 to 600 additional cases per day, and the case rate last recorded is at 38.4 per 100,000. This week, we did receive a number of cases that were backlogged, mainly from the Kaiser system. So many of you may have noticed that we had quite a jump of about 3,000 this week for one day, but most of those were actually backlogged. So we're still averaging about 500 to 600 per day. With the deaths, we are at 1,934, and we have seen an increase there. We're averaging about 5 new deaths reported per day. I have to note also that with the deaths, we do have to wait for records before we actually report it on our dashboard, as well as report it to the state. So we still have quite a number that are still pending getting all of the required documentation. Our concerns continue to be with the hospitalizations. We're still near capacity. The numbers do fluctuate from day to day. And the hospitals are coordinating to make sure that if one hospital is not able to receive patients, that they're able to send them to another hospital within the region. We have not had to send any patients outside of Sacramento County. The hospital administration is still concerned, though, that we continue to have capacity to see not just the COVID patients, but also other patients that are critically ill, such as those with stroke and heart disease or difficulty breathing, because oftentimes it's very important, every minute counts, to be able to get the appropriate level of care. So we continue to work with them to make sure that we continue to have that capacity. The other area, the hospitalizations, the last report, we're at 435 in the hospital. The peak for the winter season was 512 at the beginning of this year. So we're very close to that peak. And those in the ICU is 105. The other area of concern is with the children. As schools open, we are seeing an increase in cases among children. Most of them are mild and do not require hospitalizations, but still we are seeing an increase. And now children account for about 20% of our total cases being reported. And so we'll continue to work with the schools. We have a school team that is working to make sure that when there is an exposure, that the children and the staff that are exposed are put on quarantine. I will turn it over to Jamie White.
Hi, good morning. We got a question last week regarding who is being impacted by this current surge compared to prior surges. And I just wanted to follow up with some additional data regarding that. So one of our epidemiologists ran some demographic information on our deaths for the past 30 days compared to deaths overall. And notably, the median age for our deaths in the last 30 days has been age 64 compared to age 76 overall. And also total deaths throughout the pandemic, about 75% have been over 65 or older, but in the last 30 days, more than half have been under age 65. We're still not seeing pediatric deaths, but we are seeing much younger deaths than we have previously. Another notable trend is that Black or African-American individuals are being more impacted by COVID. We're seeing much higher rates of death in that community. Overall, we've had about 11.7% of deaths among Blacks compared to the last 30 days where 24.1% were among Blacks. So about twice what we would expect compared to the population of Sacramento County overall. That's it. And I will pass it over to Liz Gomez.
Thanks, Jamie. So Sacramento County's 13 community testing sites are still working to get to a 30-minute or less wait time, but as many others are experiencing staffing challenges, we are too. Depending on the time of day you come, you may experience more than a 30-minute wait time. In addition, there are national supply chain issues that will result in a shortage of rapid antigen tests for an undetermined timeframe. It will impact a number of our partners, including COVID testing sites, schools, shelters, etc. At this time, we still have antigen tests available at our sites, but are encouraging community to consider the PCR test, which is the gold standard, in lieu of the antigen, so we can lengthen the supply we do have for as long as possible. Thank you.
That concludes the update from staff.